What's going on, guys? Dr. Andrew Fix back here for another episode on the code. Every time I have one of these awesome interviews lined up for you guys, I tell you that I'm excited to bring this conversation to you. It's always cool. We can get two providers together to jam out on a topic. It's even more cool when both of their names are Andrew. We've got Dr. Andy Sabatier joining us. He has a physical therapy practice in Oregon, and we actually just saw each other recently at a conference, and we were kind of talking about like what we're going to get into today on the podcast. And his expertise, is in and around everything related to breathing, and we know that that's so important for all of us. So Andy, thank you so much for joining me, man, on the code.
Oh, I'm super excited to be here. Thank you very much, Andrew.
Yeah, my pleasure. Well, what I want to do is, Andy, I want to give you the floor to do a much better job than I would at just introducing yourself. Tell us a little bit about you, your background, how you became the expert in all things breathing, and then we'll get into it.
Okay. It's kind of funny when introducing myself as a breathing expert because every human being is a breathing expert. We're all out there breathing. So it's a little tricky differentiating. I'll just try to tell you kind of my life path and how I ended up here very briefly. I was a college athlete, played lacrosse in college. I was a professional athlete. I got to ski as a professional for a few years. I went off to PT school, went to a great PT school at NYU, and then I went off to Stanford and did my critical care training. So for the last 8 years after PT school, I was an ICU physical therapist. All that to say, I had a pretty robust clinical background and I still didn't know anything about breathing mechanics because despite all that, I was breathing dysfunctionally the whole time. And I was actually coaching some of the ICU patients to breathe dysfunctionally also. It wasn't until I went and studied under the great Mary Massery, one of the best physical therapists ever, who really has married the clinical piece with the research piece of breathing mechanics and put them together. Now, primarily her area of practice is with pediatrics. And when I went and learned about all this, I couldn't believe that there weren't any orthopedic PTs. There weren't really any other PTs who weren't pediatric PTs there. So when I had my mind blown about how breathing mechanics work both for and against us, I shifted my practice to this idea of putting breathing first. No matter what, breathing is the single most impactful action any human being performs more than 20,000 times every day. So if that thing that they're doing is working against my goals as a physical therapist, well, then I got to start there. And when I started doing this, it was super impactful on a single patient's life. And that turned into just a small practice that I did to meet her needs. And it mushroomed into more and more. And now I am 6 years into this practice, and this is all I do. Meaning I start with every human being breathing first, where we're going to fundamentally understand, okay, are you breathing functionally or dysfunctionally? Because if you're breathing functionally, it's going to help everything in your body. It's going to help us get to all of our goals, whether that's a pain goal or an endurance goal or a postural goal or chronic diseases or anything. And if you're breathing dysfunctionally, it's probably working against you.
Sure.
So what I do with everyone is I try to get them to just understand how the breathing system works and to begin owning it, which basically means talking about it in a way that's useful, which is
Yeah.
why we're talking right now.
And talking about it in general. I mean, like you said, sort of there in your story is like people probably aren't talking about this enough. Physical therapists, other providers, whatnot. Like, how often is breathing a centerpiece of the conversation? When we're talking about someone's knee pain, for example, or someone's high blood pressure, or whatever it might be in the medical office. Now, something you said was you were breathing dysfunctionally for a long time. Help us unpack that and help us understand what that means. Like, what's the difference between breathing functionally and breathing dysfunctionally? Because I would imagine many of us are probably doing the latter.
Sure. So I'll be really clear. You hit on the right words, functional and dysfunctional. Those are the words I like to use. You are not going to hear me say you're breathing badly, you're breathing wrong, or you're breathing incorrectly, or you're breathing improperly. I've spent enough time on the ICU watching people struggle that if you're breathing right. So how we talk about it really matters. I don't need any words like clouding up this kind of judgmental thing. So functional versus dysfunctional. Dysfunctional breathing is using a lot of energy and not getting a very big output. It's kind of neglecting some of the more mechanical pieces of our breathing. So think of your breathing system as every muscle from your nose to your groin. And all of it works in this elegant, coordinated way to not just bring air into your lungs, but to pump and power every single system in the human body and regulate our entire nervous system.
Mhm.
Biologically speaking, how we breathe is how we feel, and how we feel is how we breathe. So if I'm breathing dysfunctionally, which means I'm breathing in my mouth, I'm using my chest, my neck, my shoulders, I'm breathing more vertically, I'm basically neglecting the entire abdomen, which we're going to get into. What it does is it uses lots of energy. It doesn't get a big return on that energy. And it sets us up to basically be in a state of fight or flight all the time,
Mhm.
um, which, is going to affect really everything, right? Your nervous system runs the whole show. So it's not just about air, it's about movement, it's about chemical signals. It's literally everything. I often say that breathing is five things. Breathing is physical. It's a physical act. It's muscles and structures. It's chemical. It's oxygen, carbon dioxide. It's also dopamine. It's adrenaline. It's cortisol. It's oxytocin. But it's also mental and emotional. I differ mental and emotional. Mental is what you do with your mind, how you think. And emotional is what your mind does with you. So breathing is both of those things, but it's also spiritual. The root of the word spirit comes from the Latin word spiritus, which literally means breathing. So breathing is this multi-pronged thing that's affecting everything all the time. And most of us don't really either talk about it, or we unfortunately talk about it in a way that's kind of harmful.
Sure.
So one example being, we say just breathe. Okay, that's true. Every human being can just breathe. But that's kind of like saying just walk to somebody who just had a stroke, right? That's not really that helpful. There's more nuance to it. That's why we're physical therapists. And then the other harmful word when it comes to breathing is breath. Now, that sounds like such an innocuous word, but the very first shift that I want everybody to make who comes into Academy West is I want you to shift from using the word breath to using the word breathing. Breath is a noun. Technically, breathing is a noun also, but breathing describes movement. It is action. Breath is static. A lot of times we're looking at breaths per minute, or how big a breath can you take, or what kind of gas was in that breath. I mean, the ICU is all about those little numbers.
Mhm.
But nobody in the history of ICUs has ever said, quick, get that person some breath. Never happens, right? We say, oh my gosh, that person's not breathing. And really, when we're looking at breathing, we start to see, okay, this is movement. What's moving? That's what matters. That's the difference between functional breathing and dysfunctional breathing.
Mhm.
So we're going to spend a lot of time getting into functional breathing, but summarize it with functional breathing is the most efficient and effective way to use your breathing system to power, help, and boost every single system in your body. And take the one thing that we do 20,000 times a day and stop it from working against you, and instead get it to work for you.
Yeah.
That's what I do.
Yeah, I love that. And you had mentioned that dysfunctional breathing can set us up for being in this constant state of fight or flight, which, I mean, quite honestly, none of us need more help with that. So many of us are probably living in this like fight or flight, one thing, right to the next, anxious, stressed out, paranoid kind of mindset all the time. And it kind of works, it can also work the opposite way, right? Where we can utilize functional breathing as a tool to take us out of that, to help us not to be in that constant state of fight or flight.
100%. And what's funny is, that's not a new concept, right? There's lots of people have been talking about breathing in one way or another, sometimes imprecisely, but using it for things like meditation or mindfulness or what have you. There's also different breathing practices in yoga and all these other things. What I'm trying to do is clarify a little bit.
Mm-hmm.
Just cut out some of the confusion, because there's a lot of confusing language out there, and some of it leads to misunderstanding and harm. Case in point, me, I had no idea I was breathing dysfunctionally. And I was coaching the ICU patients to breathe dysfunctionally also, in full view of everyone: respiratory therapists, nurses, physicians, other physical therapists. Nobody tapped me on the shoulder and say, hey, do you know that's not helping them? Everybody just said, good job.
Yeah.
So when I realized that the problem was not just that I was not understanding how to do this, it was that we're all not talking about it in a way that's useful. I set forth to try to come up with the clearest way to explain this. So basically, I've boiled it down to 14 words. And we're going to basically get into that. But the 14 words of functional breathing, if you can feel these, see these, use these, understand these words, you can shift your whole system. So It starts within the nose. 3 words, in the nose. It's a really good start. There's a lot of education about that out there. So I'm gonna pin in the nose for a second. In the nose, diaphragm first. That's the most important piece of all of this, is getting our diaphragm to fire first. Not my belly, not my stomach, my diaphragm. This one unique muscle that sits in my thoracic cage, but it's a part of my abdomen, kind of confusing. It
Yeah.
attaches to my sternum, to my ribs, to my spine. And there are a lot of things that make this muscle unique. We could talk about its shape. It's this sort of dome-like shape. We could talk about how it moves, but the most unique thing about it is that it is the slowest muscle in your body. It has more slow twitch muscle fibers than other muscles. So it's very reliable. It will never stop working unless the nerves get cut, but it just doesn't want to move that fast. So the harder we try, the more we leave it behind. So in the nose, diaphragm first, chest second. Notice we're not talking about diaphragmatic breathing here. We need both the diaphragm and the chest because they kind of work like bellows. The diaphragm pulls downward, the chest kind of pulls out and upward, and that creates an inhale. But the reason why the chest comes second is the chest is made of fast twitch muscle fibers. So it's built for speed and power, like blowing and yelling and pushing and pulling. So in the nose, diaphragm first, chest second. Shoulders stay still. That's how I inhale. My shoulders have to stay still because my shoulders, specifically my traps and my neck muscles, they use a ton of energy and they don't really contribute that much to breathing.
Mm.
So lots of energy spent, less than 1% expansion. Plus, they send these neurologic signals to my brain of stress and fear, and we can get into all that. But that's how I inhale: in the nose, diaphragm first, chest second, shoulders stay still.
Mhm.
Exhale, which is a completely different motor act. All we have is 4 words:
Yep.
let go, slow down. If I can let go of my exhale, inhale, let go. I'm trying not to spend a lot of energy on exhale.
Yeah.
And then slowing down, there's a lot of different ways to slow down. I can slow down with my lips and different parts of my body. But as long as I'm slowing down, I'm increasing how much carbon dioxide my body is retaining.
Mm.
When I increase the amount of CO2 that I retain, I start to train my body to tolerate more of it. And CO2 has all these powerful benefits like opening my blood vessels, lowering my heart rate, reducing inflammation. It's the thing that I want to build a relationship with,
Yeah.
because basically CO2 is what makes us feel like we're drowning. So if, right now, if you're listening to this and you want to feel CO2 in your body, blow all your air out and wait. Your oxygen's not going to go down necessarily, but your CO2 is going to go way up, and it starts to make you feel panicky, and then you want to breathe again. So in a way, we are sort of wired to survive and breathe automatically, but we can also kind of tweak it with our conscious movements. So the more you are consciously training your breathing towards a functional pattern, the more you subconsciously start breathing that way.
Yeah. Now, to make sure I'm understanding this correctly, I think I got what you're saying, but for all of us that are listening, so what you were just saying, like if you want to feel that CO2 building up, breathe all your air out, you know, pause, wait, don't take a breath in. And when you start to feel that strong urge to breathe again, that's because the CO2 is rising as opposed to we're lacking oxygen, right?
Correct. Now, if you sit there long enough, your oxygen will go down too. But what's funny is if you really want to get the full experience, put a little pulse ox finger monitor on your finger and blow all your air out and see what happens. The oxygen goes up.
Interesting.
Now, why does it do that? Well, because as the CO2 rises, it boosts my oxygenation levels. Oxygen's kind of like the star of the show. Everybody talks about oxygen. Oh, I need more oxygen. But really, CO2 is what drives oxygen uptake. There's this thing called the Bohr effect, Bohr, named after Niels Bohr, the famous physicist. Hemoglobin, which carries oxygen around my body and CO2 around my body, oxygen to the cells, CO2 from the cells, is affected by how much CO2 is in the system. When my CO2 levels are low, meaning I'm breathing fast, I'm blowing off lots of CO2. So my CO2 levels are low. My oxygenation levels are low
Hmm.
because hemoglobin holds very tightly to oxygen. It doesn't want to give it up.
Yeah.
But if I flip that and I breathe slowly, like let's say I train myself to breathe slowly and functionally while I go out and run. Well, now my CO2 levels are higher, which means my oxygenation levels are higher because hemoglobin is now much more excited to give that oxygen into the cells. So not only do we get better oxygenation, but we get better removal of CO2. because CO2 is the byproduct, right? We sort of burn oxygen and the CO2 is what we dump back out. So if I'm breathing functionally and slowly, not only am I boosting oxygenation and helping the muscles get the oxygen they need, but I'm helping remove the CO2 from the muscles so it doesn't turn into lactic acid buildup and I get sore. So you can actually change how sore you get from your run by breathing functionally and slowly.
Yeah. Yeah. It makes a ton of sense. And I think that point is maybe like something that's misunderstood out there in the world, like just the concept of like holding your breath, for example. And it's not the lack of oxygen that makes you want to take a breath again. It's the buildup of CO2 that your body's trying to get rid of. Now you had mentioned I forget, it wasn't in what you were just saying, but a couple minutes ago, you mentioned something about the importance of breathing through your nose. And talk to us on that topic for a moment here. Or you mentioned dysfunctional breathing oftentimes involves breathing through your mouth, is what you said. But
Yeah.
uh, why is it so important for us to breathe through our nose as opposed to breathe through our mouths?
Okay. I'm going to try to not plow over a bunch of ground that's already been touched on. And, there's wonderful books out there that you can read a lot about. The main one being James Nestor's book, Breath. While, the title is tough because people forget it's breath or breathe or who knows, he talks a lot about this. And the nose is really important. Basically, your nose is like a supercharger for your system. It does more than 30 different functions. And really, the reason why we want to use it is the only thing that keeps my nose open is airflow. I'm always going to make mucus, no matter what. So if I just switch from my nose to my mouth, I still make more mucus, but I don't get airflow. So my
Mm,
nose starts to get clogged off. So I feel worse. So I use my mouth more. So my nose gets more stuffy. So basically, we're in this cycle where nose breathing leads to more nose breathing and mouth breathing leads to more mouth breathing. Now, the main job of your nose, besides being the filter, it's the humidifier, it's the warmer of the air that you're breathing. It chemically optimizes your air. It adds this thing called nitric oxide, which comes from your nose.
mhm.
And all of these things are great, but the main job that your nose does is it slows you down.
Sure.
We talked about that differentiation between your diaphragm, which is a slow twitch muscle, and your chest and your shoulders, which are much faster. If I breathe with my nose, in my nose, I have a higher likelihood of triggering my diaphragm. It's not a guarantee, but that's what we do is we teach people how to kind of like feel this and see this and understand where their diaphragm is. But if I breathe through my mouth, I just took away the slowness. I'm just breathing in through a big fast hole. So not only do I lose the filtration, I lose the humidification, I lose the nitric oxide, I lose all the cool things that my nose is doing, and I trigger my chest and my shoulders and my neck. Everything goes up. You can feel this if you're listening right now and you want to feel it. Just take a big breath in your mouth and feel your shoulders go up. Everything moves upward. So while it's easier to talk about nose versus mouth, without the underlying structure, right? Everything from my chin downward, it's pretty hard to maintain nasal breathing and make it work for you.
Yeah.
So when everything underneath has become more efficient and more effective, where you're now taking bigger inhales with less energy and you're moving things more efficiently, now you can maintain nasal breathing.
Mhm.
If it was just as easy as breathe in your nose, I wouldn't have a job,
Yeah.
but it's not, right? It's a little more nuanced conversation. It's a little more explanation. So that's why we kind of boil things down to those 14 words.
It's never that simple, right? It's like, somebody comes in our office with knee pain. If it was just about like, oh, go do a couple exercises that strengthen your knee, rub your quad with a foam roller. It's not that simple, right? It's everything affects everything else. It's this whole chain, it's this whole system. It's the five categories that breathing is that you mentioned, which I want to get into. Talk to us briefly about you were talking about nasal breathing.
Mhm.
Sometimes when I go out for a run, I try to nasal breathe only while I'm on a run. And what I notice as the person trying to do this is there becomes a point where it is really hard for me to continue doing that. It's either I need to kind of put a governor on my pace and my effort and slow down my effort on my run to allow me to keep breathing through my nose, or if I want to continue carrying on a certain pace or something like that, I almost become like forced to breathe through my mouth. What do you recommend to people in terms of like they're going to exercise? Should we try to breathe through our nose? Should we do some of each? We're breathing through our nose sometimes, as much as we can, but there's a time and a place to transition to mouth breathing. How do you have that conversation?
Every individual is on their own program, right? I say this all the time. It's your breathing. Nobody can do it for you. So I want you to be able to understand it. If somebody is just saying, should I go and play with breathing with my nose? Yeah, go play with it. Have fun. Likelihood is that you're going to get frustrated. You're going to experience exactly what you just described. That is usually the byproduct of not my nose or mouth, but everything underneath.
Sure.
Is my diaphragm firing first and most? Think of your diaphragm like a shy kid. Okay, it's like your inner child. It's this like really shy little kid, full of slow twitch muscle fibers that's super dependable, and it's been there since you were born. If that kid is getting completely overtaken by your chest and your shoulders and your neck, you are going to run into a wall eventually where you can't move enough air, the CO2 is building up, and you feel terrible. On the other hand, training somebody to breathe functionally, even while sitting still and then standing and then walking, and getting them to put that whole thing together where they know, okay, every time I inhale, I can feel my diaphragm moving first. I can feel my chest moving second. I can feel my shoulders staying still. And then I'm letting go and slowing down on my exhale. If they have those mechanics, like if we're going to use you as the example, if you've got those mechanics and you go out and run, my advice to you is run breathing first.
Yeah.
Run as far and as fast as your breathing will allow you. And if that means you have to back off a little bit, that's okay. In a few weeks, it'll get faster. And in a few months, you're going to completely blow away what you were doing with your mouth open.
Mm-hmm.
We've seen this. I like to tell this story because he's one of my favorite patients. That's why I hired him. One of my early patients with this practice was a guy that I oriented to the ICU. He's another physical therapist. He was a college runner, running marathon distances, doing well.
Mm-hmm.
And he was wanting to poke out into ultra distance, running 100 miles. But he said, Andy, every time I get to like mile 20 or 30, my neck is killing me and I feel like I'm going to poop my pants. So we look at his breathing, and the process for us is we video your breathing. We do that with, mirrors. So we can, in person, at least we do that with mirrors. So we can capture it from different angles. If we're doing that via telehealth, we just do it through the screen. And then I teach you about breathing mechanics, and then I show you your breathing. And we could see his breathing was wildly dysfunctional. Chest, shoulders, neck, the abdomen was completely missing. His diaphragm was getting left behind. So we flipped his breathing, said, okay, go running breathing first, just like I said. And about 3 weeks later, he's running faster with his mouth shut. And a year later, he runs his first ultra, mouth closed, whole time, feeling great. Flash forward to him running the Oregon 200. 100-mile race. Yeah, I mean, that's the reaction every time. 200 miles, that sounds brutal. Because, that's 58 hours of running straight for him, and he's running, right, all those mechanics we talked about. So he gets to the finish, and he tells me, he's like, Andy, I didn't really feel like I was suffering. I felt like I was dancing because you breathe how you feel. And he basically went out and meditated for like 58 hours while running, which is cool on its own. What a great experience for my run to feel that good. But it's even cooler when you hear that he beat the whole field by 2 hours.
Yeah, I would say so.
So this thing is accessible, but it just takes a consistent approach. It's almost like at first you have to put your ego aside. Your legs can run so much faster than your breathing can right now. You've been training them forever. You're a great athlete. But your breathing is the thing that hasn't been addressed. So what if you make that the priority? For a little while, you might have to put your ego to the side, but on the back end, your ego is going to be fed this giant thing of like, oh my God, I can run farther and faster with my mouth shut than the guy next to me whose mouth is open.
Yeah.
That's the kind of thing that we see consistently, whether it's in, that patient's case, who, like I said, now he's one of our therapists. He sees patients on Thursdays because he's fantastic. His name is Ben. Or just the simple case of somebody trying to recover from something. If they can be consistent, we see results.
Mm-hmm. I think it's Matthew Walker, the author of the book Why We Sleep. I think he's the one that I've seen quotes saying something to the effect of, sleep is the number one performance enhancing drug that most people aren't taking, right? I think we can make the argument that like breathing is right there with that, right? Like, breathing functionally, learning how to breathe functionally and utilizing that as a tool to improve your whatever, like we just said, running performance, athletic performance, management of stress, which may help you in the workplace be more successful and effective and whatnot. Manage your emotional tank and how you feel as a parent, making you a better dad or mother, whatever, like all the different categories, right? Like if we're not thinking about it, it's a performance enhancer that we're not tapping into, we're not using, is what it sounds like to me.
Not only that is a performance enhancer, but it's a performance detractor.
Sure.
That's the tricky thing here. My purpose in the world is to sort of spread this knowledge, and I really love it. But it is a unique challenge because one, I am identifying a problem that somebody didn't know that they had. Right? I had no idea. I had no idea. Like I said, college athlete, pro athlete, great PT school, trained at Stanford, great ICU PT. I was breathing dysfunctionally the whole time. Had no idea. So one, identifying the problem. Two, showing you the solution. The solution is functional breathing. Now, it's a lot harder than you think to find that information because there's scattershot, explanations of breathing, either this piece or this piece, but nobody's looking at the entire system. So I actually want to, is it okay if I share my screen and kind of show you what the breathing system looks like?
Yeah, let's do that. That would be awesome.
So I'm going to share my screen. I'm going to pull up this little window. Now, this is something I've worked on for a very long time.
Now that being said, I know this podcast, you guys, is you could be listening to this a number of different ways, right? You could be on one of the many podcast platforms out there. You could be on our YouTube channel, which in this case, if you're listening to this and you're in the car or you're somewhere where you can't watch the video, I would highly recommend this part we're about to get into. I can see Andy's screen now. Like this would be a sweet spot to pause it, come back to it when you can watch it, or finish listening to it and then come back to it later, re-go through this section so that you can watch the video. Because it's just going to make this make so much more sense to you. So back over to you. Let's do it.
And I'll try to describe what it is we're looking at. So what we're looking at is a human body, take away the arms, take away the legs, and really take away the top of the head. We're looking at every muscle from basically the nose to the groin. And the shoulders and neck, those are the accessory muscles. Those are red. The chest muscles, that's all the little intercostal muscles. Those are going to be orange. And then the diaphragm, which is this funky looking dome-like thing that's in the base of our rib cage, is going to be sort of teal. It's got these long stringy strands that hang down. They're called the crura of the diaphragm, which means legs. So the legs of your diaphragm come down and they attach to L1, L2, L3, L4 in the lumbar spine. Then we've got the transverse abdominis. That's going to be like the deepest layer of the abdominal wall. It wraps around our abdomen like a corset. This is the layer that pulls apart when somebody is pregnant that we're always trying to knit back together. And then at the very bottom in purple is the pelvic floor. This is 3 layers of muscles that sit in the pelvic bones, and they support things like peeing and pooping and farting in babies. So all of these work together. They're all one system, and they have to work efficiently or effectively. So the abdomen, if we're going to really go for it here, think of your breathing system like an incredibly advanced rocket ship. Now, this rocket ship, picture, for those that are not able to see this, picture a rocket ship where the bottom is sort of those same colors of purple, teal, and blue. That's the abdomen. That's the engine. The middle is kind of yellow and orange. That's the chest wall. That's like the frame holding this thing together. And the top is red. That's like the neck and shoulders. That's the navigating system. So really, this rocket ship flies you through your whole life. No matter what you're doing, your breathing is going to take you there. And taking off, the rocket ship taking off, that is inhale. It uses a ton of energy. It's over really fast. Exhale is the rocket ship flying through space. It lasts most of our life. In fact, way more of your life is spent exhaling than it is inhaling. Like right now, I'm just talking. It's like one long exhale, and I'll get a quick little breath in and then keep exhaling. So the crew of the rocket ship is a bunch of kids. The abdomen kids are really shy, but they're brilliant. Remember those slow twitch muscle fibers we talked about? That's the abdomen. So shy kids. The chest wall, made of fast twitch muscle fibers. That kid is not shy, loves to go fast. And the neck and shoulders is like the most reactive kid imaginable. They're totally bonkers because your chest or your neck and shoulders are the fastest muscles in the whole system because they're wired directly into your brain. So we want to learn how to fly this rocket ship effectively, where we get those shy kids to really come forth and do their part. Imagine like encouraging the shyest kid to be the loudest possible. And then we get the chest wall to move second, teach that kid that loves to go fast to just be a little more patient. And then the kid in the neck and shoulders, we're trying to get that kid to chill out. So as far-fetched as it may seem, moving this rocket ship in a way, it's sort of like one coherent example of like how the system works, how inhale is different from exhale, and how to operate it. But truly, if that's too difficult, your breathing system is basically a traffic light. Your diaphragm is the green light. We want a life full of diaphragm first, so green light. Then come yellow lights. That's chest wall. So diaphragm first, chest second, and shoulders stay still. That's the red light.
Sure.
So it's a stretch to sort of put it all together that way. But my goal is that I want everybody who leaves this interview, who leaves my care with any of my other therapists, I want them to feel super confident in their own breathing system and understanding it. Is there more to it than that? Yeah, but that's the basics. It's just understanding like what the system looks like, how does it move, how do we want it to move, and how do I start controlling this thing? Does that make sense?
It makes a lot of sense. And I like what you just said. Like you want all those people to feel confident in understanding the basics, understanding their own breathing system. Because at the end of the day, I feel like no matter what we're talking about, whether we're talking about exercise or whether we're talking about, becoming knowledgeable in some topic, like if we can just master the basics and master the fundamentals, that's going to take us the majority of the way there, right? There's always going to be like this small percentage of stuff at the top that we can optimize and we can continue to get better at. But none of that matters until we master the basics, right? Like it doesn't matter about all the fancy exercises that you see people posting in the morning routines and all this crap that you see online on Instagram if we're not sleeping appropriately, we're not fueling our body with nutritious whole foods, if we're not even like doing any regular structured exercise of just doing the basic things, it doesn't matter about these like the 1% little things. And the same goes for your breathing. Like let's just start at the foundation like that. I thought those visuals were great.
Thank you. It's funny because you'll hear terms like breathing exercise.
Mhm.
So, what exercise is not a breathing exercise?
Mhm. Mhm.
Right? Everything involves breathing. You sort of touched on this earlier. People come here to Academy West usually with one thing in mind. Maybe they've got asthma and they're trying to like cure it. Maybe they've got long COVID. Maybe they've got back pain. Maybe they got, gut problems, or they've got sleep problems. Or they've got sleep apnea. I mean, we could just keep going. But usually what they find is, oh, this is affecting like 4 or 5 things in my life. The same thing that's causing my asthma is actually what's ruining my sleep. It's also what's messing up my back pain. It's kind of giving me balance problems. When you train your breathing, you train all of it. There's no like you're missing a piece because you're focused in a different area. Everything in your life requires breathing 20,000 times a day. So it's a little different from a typical PT setting where it's like, okay, you've got shoulder problems. Here's your 3 exercises, do 4 sets 3 times a week. Or we could breathe 20,000 times a day. You're already doing this thing. So all we want to do is nudge the system. I want to share my screen one more time because I want to
Yeah.
show you probably the
Thanks.
most interesting piece of this anatomy.
Mhm.
So I'm going to slide over to here. So this is I'm going to zoom way in. This thing there's your brain. Okay. Your brain's connected to your entire nervous system as it applies to your breathing. Nerves that go all the way down to your groin. Okay. So your vagus nerves, like the superhighway of your parasympathetic activity. But if we look up here in the brain, we can see a couple of things. We'll see this greenish looking hexagon. Okay. And then we see these other dots up here. The hexagon, that is your breathing pacemaker. It's called your pre-Botzinger complex. It's this little area that takes information from all over your nervous system and calculates how fast or slow you're going to breathe automatically so you never have to think about it, which is why we can literally just breathe. But as we talked about earlier, every person who's listening to this right now could, in theory, just blow all their air out and stop breathing. So the reason we can do that is because my breathing system is controlled in the cortical brain up here where these dots are: red, orange, yellow, green, blue, and purple. This is where like I can move my fingers and my face and my toes, and I can write a song. I can listen to something. Like all my higher thinking, my human processes come from up here. So conscious breathing trains subconscious breathing. What I do on purpose using this part of my brain, even just a few times a day, influences what happens with this part of the brain. So whatever pattern of breathing that I'm trying to adopt, I can make happen. So daytime breathing influences nighttime breathing. How I breathe when I'm just like taking a run influences how I'm going to breathe when I've got to deal with a really stressful thing at work or in parenting or in my relationship. We're constantly training ourselves to handle the rest of life.
Mhm.
So, there's a reason that it's the reason that, like, our town, I live in a town called Bend, Oregon, which is a wonderful place to be. There's a reason that we've trained every firefighter here, because they've got to be able to show up at the scariest thing imaginable, calm themselves down, go in and do their job, and not only mentally perform, but physically perform, endure, like manage through this physical act while all the adrenaline is pumping. And although that's an extreme example, that's no different from your life, the person listening to this. You
Sure.
have to show up in your life in a way after work. You have to show up in your life as a parent, as a partner, as a son or a daughter. Like, there's somebody in your life where you're going to have to show up on a day when you're not feeling great. And when you can manipulate how you breathe, you can manipulate how you feel.
Mhm.
Every human emotion lasts about 60 to 90 seconds. That's often a pretty surprising thing for people to hear, but that's it. Like, the most intense emotion you've ever had in your life, it lasts 60 to 90 seconds. What are you going to do with those 60 to 90 seconds?
Yeah.
That's really what this is about. So breathing is the thing that's happening right now, right? There's no, like, future breathing. There's no past breathing. It's just current. It's present. That's why people are like, oh, I want to be present. So they do meditation so they can be present.
Yeah.
Well, if you're focused on your breathing, you can feel it, you can hear it, which means you're focused on right now,
Mhm.
which calms your nervous system down. So arming people with this deep understanding and really, like, a fascination. I want people to get fascinated, entertained, and satisfied with their own breathing, because then they're in that loop. They're in that positive feedback loop. Picture, all right, I'm going to kind of stitch this out, okay? I'm not going to do this with slides, but picture two different loops. So we've got a functional breathing loop and a dysfunctional breathing loop. Dysfunctional breathing at the top, there's dysfunctional breathing, means more chronic stress, which means more inflammation and worse immunity, healing, and recovery,
Mhm.
which also means weakness. Weakness in the muscles that get overused, like my neck, chest, and shoulders, and weakness in the muscles that get underused, like my diaphragm, my transverse abdominis, my pelvic floor, basically my core muscles,
Okay.
which leads to poor performance. Now, maybe poor performance is like, my endurance sucks, or my asthma gets worse, or I get headaches, or sleep problems, or erectile dysfunction, or chronic pain, or like anything. But that's actually going to lead to the next thing, which is an emotional experience.
Sure.
Breathe how we feel: shame, guilt, and fear. Shame, I'm not who I used to be or who I could be. Guilt, that I have something to do with it and I don't know how to fix it. And fear, it's getting worse, not getting better. And all of this just, like, pisses me off. So that leads to more chronic pain. And chronic pain leads to more dysfunctional breathing. And imagine that the cycle is not actually a circle, but it's a spider web. That everything leads to everything else. And the harder I try, the worse it gets, because somebody tells me to just breathe. Now, flip that. Functional breathing. Functional breathing reduces chronic stress, reduces inflammation. That's CO2. My original anti-inflammatory, carbon dioxide. That's why we care about oxidative stress. CO2 is the opposite. Means better immunity, better healing, better recovery. And strengthening my core with how I breathe doing the dishes, not how many sit-ups and planks I can do.
Mhm.
But that leads to better performance. When you can do that thing, whether it's running the race or getting through a fight or getting to sleep, that is an emotional experience. Love, joy, and purpose. It's really hard to feel love, joy, and purpose when there's this tiger chasing your brain all the time, but that's basically dysfunctional breathing. And of course, that leads to less pain and better quality of life, which means more functional breathing. So all I do is try to get people in this loop. And the whole practice started because I tried this one day. I was in
Mhm.
the ICU, and a woman got admitted to the floor above, which is sort of the subacute floor.
Yeah.
She's 36. She's got terminal breast cancer, and she needs a drain in her left lung field, and then she's going to go home on hospice. That's not a PT patient typically. That's like a leave me alone, make me comfortable. She's on 5 liters of oxygen. She's working her tail off to breathe. And I spent like 90 minutes getting her to talk about, feel, see, use, understand her breathing first. Okay, can you do this laying down? All right, let's sit up. Can you do this sitting up? Okay, let's stand up. Can you do this standing up? Let's go to the mirror. Let's take off your gown in front of the mirror. Look at your body. Now, that's a really personal thing to do, because we're talking about everything from the nose to the groin. Those are really sensitive parts of the body. There's a ton of shame and guilt and fear there.
Yep.
And so there she is, looking at her cancer riddled body, and this drain sticking out. She's starting to figure out how this thing works. Because if you can see it, you can start to understand it.
Mhm.
So I came back the next day as she's discharging, and she said, What we did made me feel better than anything has in the last 5 years. I want to do this for the rest of my life. So that's why I started Academy West, just to see her at home. And as I did that, I'd go see her every couple of weeks and just start with breathing first and then add it into whatever. And I watched her change. I watched her reduce the amount of oxygen she was on.
Yeah, right.
Breathing's getting better, but her cancer's getting worse. She's getting out of bed on her own. She can go up and down the stairs. She can go outside, off oxygen, watch her son ride his bike. Quality of life.
Totally.
And the same tools that helped her improve her quality of life helped her in the end to improve the quality of the end of her life, because we breathe how we feel. And nobody needs to die going. So this was profound. This is why I pointed my whole life in this direction, because I know I'm onto something here. I know that if we can get people to just understand that, hey, this is your breathing. Nobody can do it for you, and it's yours to enjoy. It's not work.
Right.
Breathing's a privilege, right? Work is like what we have to do. Like, oh, I got to go to work. I got to put in the work. I'm really working at it. You want to see what breathing looks like? Go to the ICU. Those people are working. This is fun. This is playful. Breathing is a privilege. It's a play. It's a practice. And ultimately, it's a performance. So that's why I'm trying to change the language. I don't want people thinking about breath work. It's not breath. It's breathing for sure, right? If I said, hey, Andrew, how's my breath?
Yeah,
Smell bagel from breakfast. So it's not breath and it's not work. It's breathing and it's whatever else you want it to be. But ultimately, it's yours. It's your breathing performance. Does that make sense?
It makes a lot of sense. And those two loops that you were talking about, like in just how dysfunctional feeds into this pattern of more chronic stress, poorer immunity, healing, recovery, all the things, like it's just like a light bulb that's probably going off in other people's heads that are listening to this, but like going off in my head, it makes such clear sense to me that and it's something that is accessible to everybody, right? If these tools help a person who is near the end stage of their life improve the quality, improve her breathing, reduce the amount of oxygen that she's needing, all this stuff, like those same things can help anyone else. And one thing that I wrote down that you said was conscious breathing trains your unconscious breathing. And
Yep.
I think that is very what's the word that I want to use? Like that's very encouraging to me, where it's like, hey, this is something that if you focus on it, if you're present, paying attention to your breathing, and you practice functional breathing, this can positively carry over to something that like you can do without having to focus on it as much because you've trained yourself how to do it. And then in a way, it kind of reminds me of like then you're benefiting from like the benefits of compound interest, right? It's like,
Totally.
hey, I put all this money in ever since I was young into this account, and now without me having to think about it, it is growing and growing and growing. Hey, I put this time and effort in. I'll be careful with the word effort, not to mean work, right? Like,
Well, it's fair because it does take an effort. And one of the most common questions I get is when is this going to be automatic?
yeah, right.
The actual answer is okay, somewhere between 2 and 8 weeks, you will notice that your subconscious breathing mechanics are starting to change.
Mm-hmm.
And it will always take some of your attention.
Sure.
The human mind thinks 70,000 thoughts a day, roughly. So those are stories. It's stories about the future, stories about the past. That's what a thought is. So if I'm just taking some of those 70,000 thoughts and I'm pointing them at my breathing, now I'm not thinking future past anymore. Now I'm actually focused on present, like you said.
Yep.
If I am aware of my breathing in the moment, I've just sort of swapped out some of those anxiety driving thoughts for something that's useful
Yeah.
and kind of enjoyable. So you're 100% right. Compounding interest, this is a really good investment in yourself.
Mm-hmm.
Your breathing. And it doesn't take a ton. Like it can take something like totally boring, like walking the dog or doing the dishes or folding laundry, all of which I do a lot of in my life right now.
Mm-hmm.
And if I just simply think, okay, I'm going to breathe as slowly as I need to, not as slowly as possible. That's a different thing. And we can get into that, but that drives your CO2 up higher. That gets you really uncomfortable.
You
But
know
if you
what?
just, okay, how slowly can I breathe while I do this? Walking the dog. You're training your system to perform differently the next time you work out, the next time you get in a fight. Like it's all connected.
I think this is kind of where you were maybe about to go. Like, let's make this tactical just a moment for for everybody that's listening, before we start the process of like winding down and wrapping this up, like knowing that it's going to take, you said 2 to 8 weeks before you start to notice some unconscious improvement in your breathing. Uh, if we were going to practice this right now for a moment, like walk us through what that might look like, or walk us through how you would recommend somebody start to implement this
Sure.
breathing practice and breathing training into their life to focus
Sure.
on it to try to improve it.
Okay, the first thing I'm going to tell you to do is throw out counting. Whatever you're doing, if you're counting seconds or you're counting anything, throw it out. Those tools are fine, box breathing and things like that, because they're getting people to slow down. But I want you to understand how to slow down, not just like artificially count your way through life. Okay, because counting actually makes you more anxious. Counting uses your sympathetic drive, so we're going to throw that out. All right, so here's what I want you to do. You're going to take your hand and you're going to hold an invisible tennis ball. For those that can't see, I've got my fingers curved. Curvy fingers are really important. I'm going to take those curvy fingers and I'm going to put it right on my diaphragm, which, as I tilt the camera down, just below my Academy West logo. I've got my hand right below where my sternum is, but above my belly button. Probably where you got the wind knocked out of you as a kid. There's another unhelpful way we're talking about breathing, wind. Okay, so with my hand there, I'm going to keep those curvy fingers in place, and I'm going to take some tiny little doggy sniffs and then let go. Just kind of stack a few in, let it go. And you want to breathe in such a way that you feel that area under your hand moving first and getting your chest to chill out. Now, in person, I do this all the time. People right away just start pounding with their chest and moving. If you have to put some fingers on your chest just to sense what's going on, you can do that. But anytime you're touching your chest, your shoulders, your abdomen, you're facilitating breathing. So sometimes putting a hand on your chest can be counterproductive because now you're going to breathe to it like a target. So focus on that bottom hand, go away from the dog sniff, and now try to stitch a few smooth human inhales together where you're going to breathe and just aim for that tennis ball. And then just let go. If you can feel that, now you know where your diaphragm is. Put your hand there in any way you want. I generally recommend kind of having my fingernails in midline and having the palm of my hand flush against my lowest ribs. Take a smooth inhale and just aim for the tips of your index finger and your middle finger. Now, if you can do that wherever you are and you're sitting, go ahead and try it standing. If you're doing it standing, try to add some movement. Try to kind of like sway in place or march. And if that feels good, for Andrew right now, I'd say, okay, go take a walk. Now, I don't want you to walk away because I want to finish our interview, but you would basically go walking doing that.
Yeah.
And oftentimes it feels kind of like rubbing your belly and patting your head, which a lot of people have done before. And how do we train ourselves to do that? Well, start doing one and then add the other. Breathing first is how I summarize everything.
Yeah.
I just want you to put your breathing first and go play with it. So walk around, run around, dance around, do whatever you want. The more intense the activity you have, the harder it's going to be to maintain. But if you can be patient and simply do that, diaphragm first, chest second, shoulder stay still, let go, slow down, you're going to stitch this all together into something that feels way more approachable. It's not enough to give people a don't use your mouth. You have to give them the do. And in the nose is a good start, but it's not enough. It's everything underneath it. So those 14 words are kind of my offering. And any person that's looking to do that, that's what we do, is basically craft the curriculum so that it fits your needs and space out care. I typically see patients about once a month, once every 2 to 4 weeks, because what we do, I need you to go play with it a couple 100,000 times and then come back. And then we're going to add layers to it. But sure enough, no matter what, I have yet to see somebody who can't get this. Even people that are neurologically dependent, we're training their caregivers on how to nudge that person's system like a therapist. And we've seen, honestly, miraculous results with some people that are pretty medically hopeless.
Like you said to me a little bit ago, go run breathing first. And I like the flow that you just went through. Do it in one position, lying down, then do it seated, then do it standing. Now try to sway, try to walk, try to whatever. But focus on that breathing first. And just having my fingertips there right about where that diaphragm is, I can feel that. I did like the tennis ball kind of having the curled fingers, because then you get to feel it a little bit easier. Just feels a little awkward to stand that way all the time. So I like the flat hand.
Correct. Yeah, that's like training wheels. And
Yeah,
the curvy fingers, the reason that they're curvy is straight pokey fingers. Remember, this is a really shy muscle. Your diaphragm is super shy. So if I just start poking it or doing what other PTs do, which is like diaphragm releases and digging around under there. All that stuff kind of makes it more shy.
Yeah.
I'm all about like, get this thing moving, get it expanding. And what I'd recommend is anybody who's doing that, stand in front of the mirror and watch this.
Yeah.
One of the hardest things for human beings to do is look in the mirror. And why is that? Well, we judge what we see.
Yep.
We see the worst parts of ourselves. There's all kinds of data out there as far as like what happens physiologically to you when you just stare at yourself in the mirror and like high five yourself. So this is that, but like times 1,000.
Yeah.
Standing in front of the mirror and recognizing yourself and seeing your anatomy just the way that first patient did, that builds a relationship with yourself that's really important because you're the only one that can show up that way.
Yeah.
So a lot of my practice is physical, like we're talking about, but I have a lot of patients that are referred from mental health providers because as much as they're getting tools in their counseling sessions, that rubber has to meet the road. My therapist says it all the time. He's like, you're doing cognitive behavioral therapy. You're taking the cognitive process, whatever they're thinking, and changing the behavior, which is their breathing, which begins to change all of their emotions. And before long, you've got this tool that nobody can take away from you, Andrew. Like no matter where you are, no matter what goes on, we could lock you in a Russian gulag and you still have your breathing because it's yours and nobody can do it for you. So falling in love with your breathing is the goal with everything.
Yeah. And, what you just said, like right there, looking in the mirror and whatnot, and that being such a difficult thing for so many people, I 100% agree. I was already planning to record a podcast on this topic, but I'm definitely going to do it now because it just reminded me too. My son is definitely not the shy diaphragm. He is so outgoing. He loves everybody. He wants to be hyper active, engaged with everybody. He's 1 year old. There's not much that he loves more than looking in the mirror at himself. He is so pumped every time he gets to look in the mirror, right? Because he has not yet gone through the life experiences that so many people have gone through that make them ashamed, whatever word you want to use, disappointed to look in the mirror, right? He's a 1 year old who he just thinks it's hilarious. He's looking in the mirror, he's looking at me, he's looking at my wife. I put him in a outfit the other day. It was kind of chilly outside. It was like this, kind of like teddy bear looking outfit. It has a hood and it has two little bear ears on it, which is not what he normally sees when he looks in the mirror. He's normally looking at himself like in a t-shirt or something. He was cracking up just looking at himself, just laughing hysterically because he's like, who is this funny looking teddy bear in the mirror? Um, it's one of those things where it's like a self-love, self-talk type of thing. Like, we all spend so much time with those 70,000 thoughts we have every single day, many of them being negative self-talk. And you can start to reverse engineer that just by practicing your breathing, right? Because breathing changes how you feel, changes the thoughts that come to your mind. Focusing on your breathing helps you focus on being present, et cetera, all the stuff that you just talked about. This is really fascinating. And I think, part of the reason I asked about running before is we have a run club tonight. And as much as I want to conversate with the people that are there, I'm going to try and run breathing first and keep the pace appropriate. And it's just going to lead to a more enjoyable experience for everybody. And who knows, maybe we end up working this into part of the practice with one of these run clubs coming up here.
That
Um,
is that it's funny because I'm doing a workshop this weekend with the Central Oregon Running Club, and we're going to host a bunch of their athletes here, and we're going to spend an hour going through nudging the system, and then go run,
yeah,
and then come back together and talk about it,
yeah,
because it is one thing to get the academic knowledge, which hopefully people are getting from this interaction, but it's another to get the experiential knowledge. Having that experience, like breathing is a movement, that starts to switch on those light bulbs.
yeah,
And if I could wave my magic wand, and I talk about my magic wand all the time. If I could wave my magic wand, I want every physical therapist to start with breathing first, because there's nothing that makes me special. I mean that there's something that makes everybody special, right? But I'm a part of the same group of clinicians that you're a part of, and there's so many talented clinicians, and yet how have we missed this one thing? The reason is we've missed it because we don't know how to talk about it. All I'm offering is a really good way to talk about it, a really good way to understand it, so that not only can the individual say, I understand my breathing, but the provider can say, here's how to understand your breathing. Here's this gift. And once you give that gift, it goes off into the world. I'll often have this experience where, I'll give a local workshop and do like a clinical workshop, and somebody will come, and then a few months later they'll come in the office and say, yeah, so I did what you told me, and my asthma's gone,
Yeah.
or my back pain's way better, or I'm sleeping again, or my ticks are down, or like what, I mean, we could talk about all the crazy things that happen, but it is the same thing. It is that positive feedback loop and getting it started, and just being curious enough to go and play around. That's what we want to do. Just go play with your breathing. Take all the pressure off. So if you're hearing this and you're thinking, I want to go do this, perfect doesn't exist. There is no perfect breathing. Your breathing is your own. You're the only one that can do it. You're the only one that can get fascinated by it. And building a relationship where you feel like this is something I enjoy is another way of trusting yourself and loving yourself that previously just hasn't been explored. So have fun with it.
Yeah. Yeah, I love that. And you just reminded me the one other thing that I was thinking of a few minutes ago before I shared that story about my son in the mirror was what I love about what you're talking about is, you talked about the words that you don't like to use, incorrect, wrong, et cetera, is you're talking about helping people understand what to do, not telling them what not to do. And that in and of a nutshell, like that, just that general premise is something that I'm definitely trying to do in my practice as a provider, in my practice as a parent, is, don't tell yourself what you don't want to do. Tell yourself, practice the things that you do want to do. And that's going to start to feed that positive feedback loop. It's so important. I use the analogy a lot of times of football. I think there's this American football. I think there's a statistic on this. But like, the end of the game, one team's ahead. The team that's winning is on offense. They have the ball. They just need to run the clock out, and then they will win the game. But it's not in a scenario where they can just kneel the ball down and the game's gonna be over. They actually have to run some plays, try to get a first down or two. The coach should not tell the running back, do not fumble. He should tell the running back or the quarterback or whomever, hold onto the ball, right? Put the positive thought, the thing that you want them to do in their mind and watch them go do it. So, same thing with breathing, same thing with your kids, all the things. And then before we start the process of letting you share how people can get in touch with you and whatnot and signing off, by no means would I consider myself a Harry Potter super fan. I've not read all the books, I've not seen all the movies, but you're talking about waving your magic wand, and I'm just sitting here in my head going, Expelliarmus, um, thinking about Harry Potter. So even though I haven't seen it in quite a long time. So if you like Harry Potter, go watch it. For us reminding you here about the magic wand. Andy, this was awesome. Um, I mean, I feel like we could do 10 podcasts on this very topic because, like you said, there's no you've made it, right? There's no end point. This is always something that you can continue to put some attention to and put some focus on. I think you left us with some great tools to try and start to go implement this in our lives today, even like right now while we were practicing a little bit ago. If people want to find out more information, if they want to check you guys out, what's the best way for folks to get in touch with you, Academy West, and your practice?
So you can visit us at our website. That's academywestperformance.com. We also are on Instagram, academy.west. And the best way that you can engage with us is start experimenting with your breathing now. Start paying attention. So when you get on that phone call or you send us that message, you know what it is that you want to improve. The things that make somebody a good fit at Academy West. You don't have to be in Oregon. We work with people all over the world. You don't have to be a professional athlete. We work with people across the lifespan, aged 1 week, all the way through over 100. All kinds of pathologies, all kinds of bodies. We really need one of these three. Somebody needs to be curious. If they're curious about their body, this is going to work. They need to be motivated. If they really want to make a change in something, this is going to work. And if they're suffering, which, let's be real, all humans are suffering, but if they can recognize this is where I'm suffering and we can connect that to their breathing, and then they can get that thing to start working for them, now we're in a good loop. because we know that suffering does not equal depression. Hopelessness equals depression. And if you have your functional breathing, you literally are never without a tool that can help you. So there's always hope. So I hope that those out there hearing this either think of themselves or think of somebody in your life who needs this. That's who we want to talk to.
Love it. We'll put those sites, the Instagram link and whatnot, in the show notes for you guys to check out. Andy, I really appreciate your time hopping on here, man. I know we've been planning this for a couple months. We finally got our schedules to line up and make this happen. I thought it was great. And man, I hope you have an awesome, awesome rest of your day and workshop with that running club coming up this weekend.
I appreciate it, Andrew. Thank you for doing the work you're doing. You are an excellent physical therapist, and every one of your patients is lucky to have you. Thank you very much.
Hey guys, thank you for tuning in, listening to this episode of The Code. Hopefully, you found something valuable in this conversation. I don't seriously know how you couldn't, but what would be amazing is if you found this useful, please go share this episode with somebody else. I'm sure you know somebody who you're thinking about right now that would benefit from hearing this message, taking these tools away. And if you've not done so, now would be the perfect time to go drop a review on this podcast to help us get it out to more and more people. Until next time, I'm Dr. Andrew Fix, and we'll see you on the next episode of The Code. We'll see you later.